Well, good morning and thank you. In case you're just joining us, we are going to be having a conversation this morning about polio, a highly infectious disease that has been said to be leading to a lot of cases of paralysis and sometimes even death in our country. We've done a lot and made a lot of progress to be able to mitigate the spread of polio, a lot of gains, but again, several challenges also that we are going to be talking about, just to understand what polio is and the progress that we have made as a country to be able to, save the lives of our children. And of course, to join me have this very conversation ahead of a campaign, by the way, that the Ministry of Health, together with the World Health Organization and UNICEF, are planning that you should know about. So this conversation is very important for you. But allow me to, introduce my guest for the program this morning. Dr. David Githanga is a pediatrician and also a member of the Kenya Immunization Technical Advisory Committee, a medical professional at Tower in matters pediatric, and of course has done this for over 3 decades. He has experience in matters, of pediatric issues and also in clinical practice, has been trained both locally and internationally. I can go on and on about his rich profile, but allow me, courtesy of time, to end it there and allow him now to join us for this very important conversation. Daktari, once again, thank you so much for creating time for us. And we just want to understand where we are at as a country when it comes to the journey to eradicate polio. We know that at some point we were declared polio-free as a country. But then recently, I think around the month of June, the health CS, Susan Akumicha, was saying that 6 cases of polio were confirmed in Garissa County. And these were in, basically revolving around the refugee camps that were found in that particular region. And this informed several things that have been done since then to be able to mitigate the spread of polio in our country. But I'm concerned about what this means for us, considering the fact that at some point we were declared polio-free. Does it mean we are going back?
Thank you very much, and that is a very important question. Polio, I think people who are my age will have seen people who are polio survivors. If you see one, you recognize one. What you'll not see are those that died. But polio is a disease that's caused by a virus, a wild polio virus, and there are 3 of those types. And I'm backing down a little bit so that we understand the basics. Mm-hmm. So I'm going to make you doctors very, very quickly in 3 minutes. Right? So wild poliovirus, there are 3 types: type 1, type 2, type 3. Right? We have vaccinations that have been there since the 50s for a long time that are very, very effective in reducing wild polio. And we had done very, very well in terms of reducing polio to a situation where we only have just a few cases in 2 countries globally. And so wild poliovirus is very important. The drops we use, like you see on the screen, the drops we use, that is called live vaccine. It's a poliovirus that has been attenuated, if you like, broken down so that it is weakened, right? So that is a weakened polio vaccine, right? It has wild polio that is tweaked so that it's not so strong. So what has been happening is that up to about 2020, we were declared polio-free, I think couple of years ago, because we didn't have wild polio virus. When you don't have wild polio virus, we are okay. But the tweaked vaccine that we gave, one of the type 2 has a tendency of changing. It can change. It can change its genetic makeup to become wild disease. And that's what we call circulating vaccine-derived poliovirus disease. So there's wild poliovirus, we haven't seen that, and there's the circulating vaccine-derived, right? Type 2. In 2016, we got rid of type 2 completely. So the vaccines that we used to give, which had all the 3 types, had only now 2 from 2016. So type 1 and type 3. So what did we find in Garissa the other day? We had a type 2 circulating vaccine-derived polio virus. And one of the ways of monitoring polio is not just a child appearing with weakness and then being diagnosed subsequently after investigation, is also sampling from the water system. If you sampled water systems, and there are various sampling points, and you find even one case of circulating vaccine poliovirus, that is an outbreak already. So we found this 6 cases in Garissa. And because we are able to track down using genetic typing, we can track down those viruses to actually where they came from. They came from across the border. Unfortunately, diseases don't read books. You're all okay, but you can get the disease. So that is how we have gone back in terms of getting a vaccine-derived poliovirus disease. Yes, that came from across the country.
All right. So for the wild poliovirus, that one?
Wild poliovirus, we don't have wild poliovirus. Yeah.
All right. Thank you for that clarification.
Yes.
But there's something you've mentioned there about, tracking this virus and where it's coming from, and the fact that you established that it's coming from a neighboring country.
Yes.
We've seen even trends, showing us that most of the outbreaks, such as cholera, measles, come from neighboring countries, not necessarily within our borders.
Yes.
Where does this place us, and probably what should be done to be able, because it doesn't matter what we do within our borders if we can still be vulnerable to getting the virus to come in from other places. What is it that we are doing to also cushion ourselves against that?
That's a very, very, very good question. I wish viruses understood borders. And
stay there.
Stay there. Don't cross the border. Just stay where you are.
Yeah.
They don't, unfortunately. And borders are basically contiguous. I mean, they are continuous. Whether you talk about the Sudan, whether you talk about the Somalia, they are just basically continuous porous borders, which is what we have. When we have instability for all sorts of reasons, weather, political, and so on, people move to save their lives and their livelihoods. And with that comes viruses. So technically, the better thing to do would be to actually vaccinate people at the border. When you have a weather like we have right now, all these waterborne diseases become even more serious. I mean, we talk about polio transmission being human waste getting into water and you drinking that water, or eating vegetables that have been washed with that water. That is true for cholera, it's true for hepatitis A, it's true for norovirus, it's true for polio that we're talking about. So that we expect that to be on the increase. So ideally, what should happen is make sure, number one, your populations are fully vaccinated. We know there are children who have not received even one vaccine, particularly in hard-to-reach areas because of mobile populations, sometimes in the inner cities, in the informal sector, people who have never received any vaccinations at all. In general terms, you want to have 90–95% of your population vaccinated so that you are protected. Then the population that is moving in, looking at logistics of vaccinating those as they come in, that would be the ideal situation. But of course, there are many, many considerations when people are moving from one country to another because of war, because of drought, because of conflict of water, and so on. That is a challenge. But generally speaking, we are actually affected by what happens around us. What happens in Somalia would happen in Kenya in roughly 2 hours, isn't it?
Yeah, true.
It's just a flight away. So it's important that people make sure their kids are vaccinated, and they are vaccinated fully. Usually we give 3 vaccines. Most of the vaccines come in 3s. Month 1, month 2, month 3.
All right. I'll cut you short, Dr.
Yes.
Because I want us to go step by step.
Okay.
I'll want you to run us through the vaccination schedule later on. But just to understand also this disease in a more basic way, you had started by telling us the types. You've talked about 3 types. But, there are people who could be asking themselves, there's a certain instances you'll find somebody is paralyzed. In certain instances, it's non-paralytic.
Yes.
Does it affect the spinal cord? Does it affect the brain? Is it both? Yes. Just to understand this polio in a basic
Excellent question. Now, polio, when you get, let's say you get infection infected by poliovirus, it has one of three ways. It passes off as just a cold, like any other. Runny nose, a little bit of a fever, and then it goes away. Bit of a headache, muscle pain, it goes away. The second one gets actually a little bit more sick and even gets weaknesses, and that's what we see at the end of it. You kind of lose power in your muscles, the lower limbs or even the upper limbs. What you do not see are those that get paralysis of their respiratory muscles. Those ones die. They're basically paralyzed and they die. They don't
because
even...
Of difficulties
in breathing because of their nerves are kind of paralyzed by the virus. So what we will see is a person who is a victim or a survivor of polio. We will not see the one that had a mild flu-like symptoms, and we may not know the one that has died. So vaccination still remains very, very important. Surveillance, and that's a term you'll hear many, many times, is very, very important. How are our water systems? Is there any history of a child who has just gotten paralyzed without any injuries and so on? High index of suspicion is a term we use in medicine to think about it so that you look for it. So there are systems that are scanning for that possibility. Then there's a whole issue of strengthening routine immunizations. What are routine immunizations? Those are the immunizations that we go to when a child is born, 6 weeks, 10 weeks, 14 weeks, 6 months, 9 months, 15 months, 18 months. Those are routine. Those have got to be strong and strongly followed through to make sure that we have the bulk of the population or the most of the children having the vaccines to protect themselves, because we have what is called herd immunity. If all of us are immunized, then we protect each other.
Yeah, true. Why the focus on children? And by this, I want to understand polio. Does it affect children mostly vis-a-vis adults? How do you compare that?
Yes. Polio largely affects children under 5. That does not mean that you cannot get it. Adults can get it, but the possibilities reduce, pretty much like a lot of the viral infections. Most of the children will get viral infections, but adults have developed some level of immunity to some of those illnesses. So you can get, but largely we are focusing on the under 5s.
All right.
But it doesn't mean that you would take water that has a cholera or polio virus, because you can still get theoretically.
So adults, children, anybody
yes, you can.
Is vulnerable and can get polio. Can it be treated?
Yes, in general terms, viral illnesses are not treatable. They're not treatable. The body basically tries to manage itself. All you can have is symptomatic treatment.
All right.
That makes vaccines very important.
That's why I asked that question, yes. Because now that's where we go. Because
there's no treatment.
Yeah, there is no treatment for polio.
No.
The only thing that experts are really insisting on is vaccination. Make sure that you are vaccinated against this. First of all, as a parent, as a caregiver, make sure your child goes through the entire schedule of the vaccination that is recommended. And in case there is a campaign, you also ensure that your child takes part of that. And that is what we want to talk about. But before we talk about what the Ministry of Health is planning, this vaccine, how does it work? Why is it important? Why so much insistence on vaccine for managing polio?
Yeah, this, first of all, is a disease that is completely eradicable. The Rotary International actually started a campaign and have worked very hard, contributed billions of dollars to actually help eradicate polio across the world. But while polio virus in one country, even if that's Pakistan or Afghanistan, affects us, okay? So this is a disease that you can completely wipe out of the face of the earth, pretty much like what has happened with smallpox. We no longer see smallpox. It was completely eradicated. So this is so because we have effective vaccines. We have the oral polio vaccine, which is a live vaccine. We also have injectable polio vaccine, which is a killed vaccine. And there's something called the end strategy. As you vaccinating more and more people, you have total vaccination of all the populations. Then you move over from the live vaccine to the killed vaccine. For instance, in the United States, you do not find them giving oral polio. They give injectable because they do not have polio, and many of the countries in the West. So there is that changeover period where you have vaccinated everyone totally, and you've gotten rid of the wild polio virus. Then your small little risk of that type 2 changing, which is what has happened right now, is removed by removing away the oral polio vaccination. So circulating vaccine-derived poliovirus, but it's a very important vaccine for a sort of a country where we are now, because we still have a number of people who have 0 doses. They have not been vaccinated at all. So important to take children for routine vaccination. Important to get the requisite number of vaccines that you require. We give this at birth. When a child is born in the hospital, we give them 2 drops. 6 weeks when they come for review, we give them another 2 drops. And then 14 weeks, we give them another 2 drops. Okay? So we have to get 3 of those, not just 1 or 2.
All right, so let's talk about the campaign that, the vaccination campaign that is upcoming. It's not the first, it's the 3rd round.
Yes, this 3rd round.
Yeah, just tell us a bit about what was first of all, generally the outcome of the 1st and the 2nd.
Yes.
If you were to assess what was achieved, and even as you take us through this 3rd round,
yes.
I'm hoping that people will be able to understand which counties are being targeted, because for every round it's targeted in a certain area. How many children? What are we looking at?
Right. Yeah, thank you very much. That is a very important question. Now, which counties are being targeted? This is the 3rd round. I may not have the exact figures of the numbers that have been done, but what we are hoping to have, and this is the round 3 that starts from the 11th to 15th of November, we are targeting about 3 million children under 5. Okay? And we are also targeting about 250,000 5 to 15-year-olds, because those are still vulnerable, particularly in areas that this has not been done at all. So a total of 3.4 million children require to be vaccinated. Sorry about my phone ringing.
People should stop calling
yes,
now.
I don't know. They should know I'm on TV and stop calling me, please. Yeah. Now, we are implementing this in a number of counties, right? Nairobi, Machakos, Kiambu, Kajiado, Kitui, Tana River, Garissa, Mandera, and Wajir. Unfortunately, because of the rains, we have had to reschedule Garissa, Mandera, and Wajir because of inaccessibility. We've just merely postponed, and this will be redone because it is very important. Remember, Garissa is where we started off our first 6 cases of acute flaccid paralysis. So it's very important that those areas are covered. But right now, because this has got to be taken to the communities, the roads are impassable, and you don't want people getting into trouble at all.
All right. I'll just request you to run us through the counties again.
Yes, okay.
In the interest of those who are watching, who are residents of those counties, where this campaign will be taking place for this 3rd round.
Okay.
It is 3 million children who are being targeted.
3 million children.
Right. In which counties?
The first one, Nairobi, Machakos, Kiambu, Kajiado, Kitui, Tana River, Garissa, Mandera, and Wajir. So those, but the last 3, Garissa, Mandera, and Wajir, because of the current situation, we will not be able to begin in this 3rd round, but this will be done shortly as soon as situation enables us to be able to move in those areas. You know, the roads are kind of not in good shape at the moment. So from the date of 11th to the 15th, you will be getting the 3rd cycle. People have gotten already 2. The children, the primary targets, have already gotten 2 rounds in the month of October, and I think September was the first one. So they will be getting the third one. And usually when they do have, they do vaccinate, they find a child who is eligible for that age. They will mark the house, how many there are, and they will say this is round 3. It's very important that all those children, even those that have been given routine immunization, remember we said the current vaccination we are using is a very specific one. It's against type 2, which does not exist in the routine oral drops. The routine oral drops have type 1 and type 3, but we are talking about type 2.
Type 2.
Yes.
And that is for parents who usually say, my child has gone through the entire schedule of vaccination. They don't have to be vaccinated. So you say that every time there is a call for a campaign for vaccination against polio, it's important that parents and caregivers avail their children for this, because there is a specific reason why that is being done. And for this time, it's targeting the type 2 polio, not the ones that are usually covered in the routine immunization.
Very good.
All right, so the residents of these counties, Nairobi, Machakos, Kiambu, Kajiado, Tana River, Kitui, Wajir, Mandera, and Garissa, these were the targeted areas. But like Daktari explains, in Wajir, Mandera, and Garissa, that has been postponed to a further date because of the weather, and of course this leaves the 6 counties, the residents in these counties between 11th and 15th of November. The third round of vaccination will be happening in those regions. So Daktari, what will be happening? What activities? So what should people expect? How is this exercise going to be driven?
Generally, we have vaccinators moving in all those areas. There will be the fixed positions, and that means the routine, usual clinics where people go for vaccinations. Those will be centers for immunization. So you can go there if that is convenient for you. But there may be populations that are moving. They're moving, they're not near where the vaccination center is or a clinic is. There will be people who will be dressed in attire that you'll be able to recognize as vaccinators, and they will usually identify themselves, and they will basically identify the population and vaccinate the children, give them 2 drops, and usually they put a mark on the finger so that you're able to recognize that that child had been vaccinated. So and that's part of the reasons we are doing this program, to let people...
Just put it on silent?
Yeah, it's actually on silent. I don't know.
Why it's doing that, okay.
My phone is ringing. So I think you will be able to see visible signs, because the whole system of administration and the health workers are visibly dressed in yellow or some other attire that you'd be able to recognize them as vaccinators. So we are kindly asking that all those children are availed. There are areas that we call hard to reach. The hard to reach areas are not just because of physical difficulties. They are also in the inner cities where people feel they have been vaccinated and they get their vaccines in a particular situation. No, they will not have gotten the type 2, because type 2 doesn't exist. It's very important for those gated communities to allow their children to get this vaccine, because it is very, very, very important. Are you safe because you live in a safe area? No, you're not. Earlier, sometimes this year, a case of circulating polio virus was described in New York. It was reported in the press. So, and this is in a good hotel. It's not in some ramshackle of a place. So anyone can be in danger. So parents are encouraged to take children 0 to 5, even if they had been vaccinated even a week before, because they will not have gotten the type of vaccine we are giving now. If you have any questions to ask, we are quite happy. There's a doctor near you that you could ask. There are pediatricians basically across all these counties that you can actually ask. But I'd like to assure people that this vaccine is safe and very important for the children. We are alive today because we've been vaccinated.
All right. Just to address some of the complexities that usually come, especially now that you've touched on the gated communities, and I would also cite the urban centers. Most of the time you'd find that the parents are away at work when this campaign is being conducted. Do you find such challenges, and how are you addressing such complexities whereby you find it's only maybe a nanny or somebody that has been left under the care of the children are with the nanny? So what sort of awareness do you create to be able to address this complexity so that the parents take fully advantage of such campaigns whenever they are rolled out?
Generally, we approach this in multiple ways. By having a public address system, people announcing and so on, health workers in those areas, by using radio systems, and there are a number of my colleagues who are actually talking in various stations and so on, especially the radio, because radio penetration is much more efficient than TV. People are talking through this so that they understand about it. People in the urban areas are very influential even to the people in the rural areas. Many people will call their relatives in urban areas to say, are these vaccines okay? And that is partly why we are educating them on this forum to be able to understand there's a campaign running between the 11th and the 15th for polio. So when you see those people, recognize it's important. You have a child who is under 5, have they been vaccinated, the first 2, and you allow this. So it's a word of mouth as well as using the public address system. I don't know how to do it.
You just pass it somebody to help. But then even as we continue, having this conversation, you've touched on a very fundamental issue. There was a report earlier about a certain religious, group that was a bit concerned about the safety of this vaccine. We've seen even clips of, these healthcare workers going to some homes and they are locked out, and we see some dramatic scenes of parents really rejecting and saying that their children are not going to be vaccinated. Don't know whether it could be because of the concerns they have on safety or not. Maybe just to speak to those populations that are yet to really grasp and understand whether this vaccine is safe for their children. Is there anything that could justify their fears?
Excellent question. For vaccine-preventable diseases, and there are many, and many of us are alive today because we have been vaccinated against polio, against measles, against pneumonia, and many of those other diseases. For you to be protected from a disease, there are 2 ways. You can get the disease. If you survive, then you have full immunity. But the other way, and you're not guaranteed that if I get measles today, I will recover from it. I may not recover, or I may end up with serious consequences. But the other way, and the safer way, is to get the vaccine. And the vaccine is usually an attenuated or broken down component of the virus so that your body produces ascaris, we call them antibodies, to protect you against that particular disease. And the idea here is to give you a full complement of the vaccine so that your body stays in constant state of readiness. That if you run into that particular virus, your body produces antibodies that will usually knock out or kill that particular virus. So vaccines are, on the whole, safe. The mild sort of vaccine illness we get post-vaccination, maybe feeling a little bit off color, they may get a bit of fever and so on, usually 24, 48 hours, and you get better. So the risks of the disease are a lot higher than the little discomfort you get from a vaccination. So vaccines are safe. There are people who, for all sorts of reasons, believe that people are trying to do one thing or the other. And so
the mistrust.
The mistrust, sterilization and so on.
Yeah.
It's too costly to try and sterilize you using a vaccine. Probably other things that are making us sterile, not the vaccines, which are very costly, by the way, to administer. So vaccines are safe, and you're really talking about a very vulnerable group. And what it is if you feel unsure, go to the nearest place where these vaccines are being instituted. For instance, we have private institutions that have offered their places to have those vaccines being administered at. If you trust that particular area, go there and you'll be given. you'll be given the vaccine. So vaccines are safe. We are alive because we have taken vaccines ourselves. And we must ensure that the vulnerable children are also taken to be protected from potential disease from which they may not recover. So I would want to reassure the people that worry for all sorts of religious reasons and personal reasons that vaccines are unsafe. They are safe. They are totally safe. And they are checked out by various independent bodies. Yeah, not just one person.
All right. You talked about this being the third cycle. Just to get clarity on that, does it mean that the children who were vaccinated in the previous rounds are the ones being targeted in this as well? Or, yeah, just to explain. Remember we said
you have to have 3 rounds for you to get full complement. When you get the first cycle, you develop a certain level of antibodies. Then the second one, the level of antibody goes up. Then the third one, you reach the optimal level. So these are ways of vaccinating that have been worked out to find out how many drops do you need to get over what period of time to get optimal antibody protection. So if you got the first one, you need to get the second one and the third one for you to be completely protected. And that will be true of many, many of the other vaccines, pneumonia and cholera and so forth. Yeah. Usually we give more than one.
More than one. What if there's a parent who's asking themselves now that, you know, my child didn't get vaccinated in the first round and the second round? Do they have to be vaccinated?
I think it's still
a different vaccine, or it's. Yeah?
I think it's still important if they miss the first round to get when it's being offered. Remember, the type 2, they do not have any type 2 antibodies, and that's what we are protecting them from.
All right. Yeah. I want us to talk about also adults a little bit, because we've talked about children and immunization. Do adults also need to get this vaccine? When and where can they get this vaccine? Because you said polio can even affect adults.
Yes. Yeah? Generally, let me back down a little bit. When you get the oral polio vaccine, which is a live vaccine, it protects, it gives you what is called gut immunity. Gut immunity, meaning that the stools passed by a person who has that protects the other person. But the injectable vaccine, which is a killed vaccine, does not protect another person. It protects only you from getting what is called a generalized disease. Okay? So what we usually will give adults generally, and unless, of course, you're traveling to countries that have demanded. And remember, sometimes back, you couldn't travel to India if you didn't have a polio virus, even as an adult, because they had gotten rid of polio and they couldn't trust that you're not importing a disease to them. They insist that you must have. So there are vaccination centers that adults would get this because there'll be travel vaccines and so forth. But adults have a relatively less risk compared to children under 5. But if you're traveling, in some places, they would insist that you actually show your vaccine certificate, and usually we'll give you injectable polio vaccine, all right, which is a kill vaccine.
Okay, I'll take you back to where we started as we're about to wrap up. How disastrous is this disease? And I want you to talk to that parent who is still not sure whether they'll take their children for this vaccination or not. I mean, let's talk to us about the magnitude of how disastrous and dangerous polio is and what it can affect or do to a child and what the parent needs to do.
One of the most important things for a child is to remember that a child has a long lifespan. And you help a child navigate through processes of life by giving him every single benefit they require. Imagine a child who cannot walk, run, and play like every other child. You've already reduced their chances. And this is a child who survives the polio, and they get paralyzed. They never get a fair chance. And I think there are some of our ambassadors, polio survivors, who talk passionately about the disadvantages you have when you cannot move. And you know, part of children's lives is to play and to be like others. They want to be like other people. And what you do not want to disadvantage your child by not giving them optimal chances of survival in physical ways and also in terms of progression as adults. We bring up children to be able to look after themselves. If they have to be looked after all their lives, they become a burden to you, they become a burden to society, and their own self-image. They never reach their full potential. So the fear of vaccines must not stop us allowing our children to grow to what they should be. So let's be confident enough. We are here today because our mothers were courageous enough and were trusting enough to be able to give us the vaccines that we required. This is not the only country that we get vaccinated at. In fact, all countries in the world vaccinate their children. The differences will be what kind of diseases exist in those areas.
All right.
They will not be probably vaccinating against cholera in
where would we
some...
You can just imagine what would
yes.
have happened.
Exactly.
You sit on the Kenya Immunization Technical Advisory Committee, and you've played a pivotal role in, several initiatives that have just sort of, tried to help us as a country make some progress in terms of pediatric matters. If you look at the journey over time in addressing polio, what are some of the things that stand out for you? Where are we at, and what's the hope for the future when it comes to combating this disease? How would you rate us?
I think we're doing well. We have just a few people who need to be convinced. And the few people that need to be convinced are mainly the educated middle class. And we are living at a time of questioning everything. We question everything, even when we don't really need to. But the biggest danger is to only have half the information. What I would say is that I'd view the middle class as the influencers, because we influence things even when we sit in Nairobi or in Mombasa, Nakuru, Kisumu, to our relatives out in the rural areas, because they call you. They say, what shall I allow this to happen? So what I would suggest is that the little pocket of people who are doubting, it's important that you seek a health professional that sits through with you and gets you to understand why this is important, because that one person detracts many others. But on the whole, and I have participated in these campaigns, whenever you go to the informal sectors, people actually do not have that sort of a problem. It's the gated communities that have these problems, and particularly Kenyans that are coming back from diaspora. They constitute a significant population that are resistors of these vaccinations, and they live in gated communities. But I think we are trying to get those one by one, one person at a time. But please educate yourself and know that you have a responsibility for not just your child, but also the children around you, because viruses don't know boundaries. Anyone can get affected. You may think that your child takes clean water and so on, and you give them bottled water. When they go to school, they will swap, and you can become vulnerable. So we have made progress. The little bit that's remaining, we are still working at it.
All right, but it's good to end on that optimistic note. Thank you so much, Dr. David Ithanga, pediatrician, also a member of the Kenya Immunization Technical Advisory Committee, just talking about the campaign that is slated for the 11th to the 15th of November this particular year, the third round of the polio vaccination campaign being spearheaded by the Ministry of Health, which is working with UNICEF and World Health Organization. A number of counties are targeted, 9 in total: Nairobi, Machakos, Kiambu, Kajiado, Tana River, Kitui, and of course also on the list is Wajir, Mandera and Garissa. But for the 3 counties of Wajir, Mandera and Garissa, this exercise is not going to be taking place between 11th and 15th, courtesy of the weather and how it has disrupted movement and transport. It shall be done at a later date, but they are among the targeted areas for this particular campaign. And that is how we end it right here on Daybreak on our health segment this Wednesday. We really appreciate your time. Enjoy the rest of your viewing and enjoy the rest of your day.